on healing with light, a scientific insight. So these therapies were not used with scientific data. So those days, these kind of therapy were not used with scientific data. But today, especially chromotherapy, how the photochemistry, photobiology interacts with the human, with the cellular, molecular level, how they are interacting. So this therapeutic approach has got a scientific data, clinical data. So this is what we are going to see today. Listen from the expert that how this chromotherapy has got this scientific backup and what is the understanding between the light and its interaction with the human physiology and receptor, cellular and molecular level. So I welcome, on behalf of all of you, I welcome Dr. Neeraj Kumar Floria, faculty of AIMST University, Malaysia. So who is with us today to deliver the talk on this chromotherapy, its scientific insights. So I thank him once again for taking his time in spite of his busy schedule to, share his knowledge with you. Thank you all once again. Have a great session.
Thank you, ma'am, for your inspiring words and for gracing us with your presence. Your guidance and encouragement will surely motivate us to strive for excellence. It is now my pleasure to hand over the floor to Dr. A. Sanjeeva Wari, Associate Professor, Amity Institute of Pharmacy, to introduce our esteemed guest speaker, Professor Dr. Neeraj Kumar Fuloria. Please, sir.
Good afternoon to all. I am here to introduce today's guest speaker, Dr. Neeraj Kumar, B Pharmacy from Pharmacy from Rajasthan Institute of Health Sciences in 2003 and PhD in Pharmaceutical Sciences from Gautam Buddha Technical University in 2010. Currently, Dr. Fuller is serving as Professor of Pharmacy at University of Malaysia. His research areas design, synthesis, biological screening of therapeutic agents such as anti-infectives, antibiotics, and compounds. He is also active in pharmaceutical investigations, spectral characterization of compounds for therapeutic activity. Research profile is cited works in topics like cotinol, that's what we call it as turmeric, and inflammatory lung diseases mechanism. Dr. Floria has 18 credit of According to AD's Scientific Index 2025, he is among the top scientists at University Asia in the Department of Pharmacy and Pharmaceutical Sciences. In 2020, received the prestigious Young Scientist Award for his outstanding research. May the floor is pleasure. Thank you.
Sir, you can start the presentation now. Please share your screen.
Okay, thank you. A very good afternoon, everyone. I'm sorry I couldn't hear whatever happened just now, but I could hear only one few things like Dr. Lakshmi was speaking something and another person was there. But anyhow, I hope I am audible to all of you, I believe. Am I audible to all of you? Am I audible to all of you, please?
Yes, sir.
Hello?
Yes, sir.
Oh, okay. Okay, thank you. I think already my a brief introduction has been given. So, but I'm sorry I couldn't hear. It's okay, fine. First of all, I would like to thank to the MET management and Dr. Mohana Lakshmi to give me this opportunity to share my experience and a little knowledge with all of you, especially the students, because she was more concerned like if we can enlighten them with something new, something different. um uh, okay, when if I am pretty loud and clear, I hope students can listen to me clearly. You see this your hall, I could see here a lot of colors are there, the chairs are green, the sofa is there with a bluish green color. The walls are white. The podium is brown. Correct. Let's say, assume if the whole room is one color, only black or only green or only white, no colors, then it won't be so attractive, right? So that's what I'll go through the the general pattern and some clinically established things, that is your healing yourself with light. Normally, being a pharmacist, we all use medicines for treatment, right? So here today I am introducing one very interesting topic, that is chromotherapy, also called as light therapy, also sometimes called as color therapy, and it has got a different names. So today's topic of my presentation is healing with light and providing a scientific insight into chromotherapy. Okay. So I would like to share my screen with you. Okay. I hope my screen is visible to all of you. I'll make it full screen. Okay. Yes. So to introduce about, you can see a beautiful picture is there, nice mountain, flowers, and all those things. So if let's say if you are already into this place right now, you're just watching it online. Uh, so how will be your expressions? Like your blood pressure will be calm, it will not be high, you will be very stimulating, you will be very activated. So natural, these are the certain natural colors are there that acts as a form of energy that surround us, wait, my this screen is, I think it's some problem came. Yeah, I hope my screen is visible to you, right? um, okay, never mind. So what happens, the colors, like when present in the sunlight, have a significant impact on plants, animals, and humans as well, isn't it? So these colors plays a vital role in lives of all the living organism, and these each color affects our body uniquely with its hue, intensity, temperature, and energy level. So, before coming on to your, this complete description of this color therapy, let me tell you, you might have heard one name, National Institute of Health, NIH. NIH has categorized the various domains. As per earlier, it was called as NCCAM, that is National Center for Complementary and Alternative Medicine. Now it is National Center of Complementary Integrative Health, we call it as. So there are different domains you can see here. One is alternative medical system, in which we categorize Ayurveda, Chinese, Native American, all different kind of medical systems. So these are the alternative medical system is one domain. Second is mind-body intervention. Third is biological based therapies. Fourth is manipulative body-based method. And next is your energy therapies. Among this chromotherapy, also called color therapy, is categorized into the energy therapy segment out of the 5 domains. The 5th domain is energy domain that NIH has categorized this one. Okay. So, what is this color therapy? We gave it as a different name like light therapy or chromotherapy or phototherapy also. Different names are given for this kind of treatment. So usually in this, it involves visible, the electromagnetic waves that ranges normally from 380 to 780 nanometer for the treatment of different diseases. And also it promotes the overall health and well-being of a person. So going to the history of this chromotherapy, actually it's a very ancient system of healing that is the many centuries before, like Ayurveda describe the 7 chakras in our body. I think many of us have heard about this. So these chakras are different colors are given if you see in this image. So like there's a red, orange, yellow, blue, indigo, violet. So all these different colors are associated with these different chakras. So they have their own importance, function, and the functioning in the bodily system. So around your 2500 years before, your Pythagoras applied the color light therapeutically at that time. At that time, the color halls were usually used in for healing purpose. Like it used to be done in ancient Egypt time, China, and India time as well. Later, the Niels Finsen from Denmark in 1877, who has been designated as pioneer of modern chromotherapy, he studied the possibility to assist the healing of wounds with visible light. So he was the pioneer. Later on in 1933, Dinshaw was there that who explained how the different colors offers the different therapeutic effect on organisms. So we'll come on it one by one. So usually what is this CT chromotherapy can help us? So it can help us with, in treating variety of conditions like stress, depression, aggression, anxiety, high blood pressure, sleep disorders, certain type of cancers and skin infection. One example I'll give you. Let's say you are in a hot sunlight. Okay. So right now it's a rainy season anyhow, but before this, I think 15 days before, it was very hot. So by the time when you go in a hot sunny area, especially in like you see the south coastal region, like in Chennai and all, the temperature is very high. In Rajasthan, we say the temperature is very high. When you go directly without sunglasses, you see your body temperature, blood pressure, everything will be high. Once you use the cool glasses like a black goggles or the green or different colors, then your blood pressure, everything will be normalized. I mean, the variation will be in the blood pressure and temperature. It has been proven scientifically. Similarly, example I'll give you. You are in a very angry mode, aggressive mode, and suddenly I put a ice cream in front of you with a different colors. So you're like for a child is crying, you just keep a softie or some ice cream with a pink, white, the rainbow color. The child will be immediately quiet. Correct. his anxiety, his aggression, stress will be all gone off. So color impacts because the color penetrates through our rods and cones. I think you have already studied the anatomy and physiology. So in that plays a role. From there, the color radiation passes and affects our normal physiology. So it is used in treating various conditions like stress. Mainly through the brain, it is stress, depression, aggression, anxiety, blood pressure, sleep disorder, and all. So, coming to your chromotherapy techniques, normally the chromotherapy is applied by two major ways, methodologies are there. One is they will expose the color to you. You have to see the color. Like example, sometime it happens, you go to a hotel or you go to a hospital nowadays, they change their interior entirely greenery will be there, the color, all everything will be changed. So you will be your anxiety, everything will be slowed down. So by looking at a particular color, in hope that it will elicit the desired response in our body, or secondly, by directly reflecting the certain colors on our part of our body. Okay. So normally what happens, this chromotherapists, they believe that colors can enter our body through our eyes and skin. And because we know that every color has got its own wavelength and unique frequency, and if frequencies, that means energy is there. So each unique frequency will have a distinct effect on the people, and it is used for different ailments. Like, for example, your warm colors. So these provides stimulating effects, whereas cool colors, so it provides calming effects, isn't it? So normally the scientists explored, this ancient healing method in 19th century, and they developed several devices to administer and assess the benefit of this chromotherapy to the patients. So early chromotherapists, they expanded this chromotherapeutic practice to phototherapy and photobio modulation, we say. That is a low level laser therapy we call. So in this, we have the two major techniques. One is phototherapy. In this phototherapy, what do we do? We utilize the polychromatic light to promote the healing. The second approach is photobiomodulation. All this I'll be explaining in detail later. So I'm just giving a brief introduction what is all about. So in phototherapy, we gives polychromatic light to promote the healing. And in photobiomodulation, what we do, we employ the near red or infrared electromagnetic waves to stimulate the tissue regeneration and recovery. And these electromagnetic wave, those are therapeutic one, acts at mitochondrial level, particularly on enzyme cytochrome C oxidase. Okay, so that's a major way how, but later I'll discuss all this in detail. Now let's come to the physics of chromotherapy. What is the physics behind? We all know, like, visible light comprises seven colors called Vibgyor, that is violet, indigo, blue, green, yellow, orange, and red color. Okay. So red have got the longest 780 nanometer wavelength, and the violet has got a shortest one, that is at 380 nanometer. But if you see, the red color has got the lowest frequency, so it penetrates tissue more effectively than another. So various factors like wavelength, intensity, your beam weight, illumination geometry, and tissue type will affect ultimately the penetration of light. And additionally, it has got a higher heating capacity. Red color induces the heat in our body. Okay. Wait. Yeah. Okay. So, when the light interacts with an object, we all know about the physics a little already, right? It will undergo reflection or refraction or absorption, transmission, and diffraction. Where except the green, isn't it? So usually this is reflected to our eyes and perceived through our, the retina photoreceptors are there, that is rods and cones. So these rods and cones, they are the reflectors. So, white color absorbs all of them. So, intensity and pigmentation and refraction, diffraction, and transmission of colors usually. So, while lighter will reflect more. So, there are primary colors we all know, that is red, blue, and yellow. So these three primary colors combines together and form the secondary colors. You can see we have shown secondary and one is for the tertiary. So these red and yellow will produce a orange and secondary colors. So mixing of this primary color with secondary color again will generate your tertiary form of color. So these are you can see the golden, the coral, the magenta, likewise the different colors are there. Correct. So this if you see the magenta color, it comprises 2/3 of red and 1/3 of the blue color, while coral blends 2/3 of red or pink with with 1/3 yellow. So other tertiary colors are also there. We have seen, you can see here in the wheel, that's indigo, the olive, the golden, we use for this chromotherapy. So in this chromo or light or color therapy, the colors are absorbed through the skin, through the eyes, through the food, through water or air or lungs by any means. Correct. Like example, I think you must have heard about dal makhni. So let's say if it is a white color, how it will be your feel? I mean, you will be more, the aggressive. What is this? So example, the color, everything affects us. Pink color. Usually the females, they are attracted towards light pink, light sky blue, all that. And if you see the boys, they like the dark, the blackish, the grayish, the brown, the dark color, isn't it? So depends. So for every person, the treatment, the different color will be used based on the, based on the sex also we see. If based on the age also, for a newborn baby, if it's a newborn baby, they cannot see all the color. I think you all must be knowing, right? They can see only the blackish, grayish, or white. Later on, after 2 to 3 months, they can see the primary colors. Later, after that, 4 to 5 months, they can see the secondary color. After that, they can visualize all colors later. So for this, this chromotherapy, because when we do the chromotherapy, we don't do only for the adults. It's from the newborn baby. Moment the delivery is done, after that, in the nursery bed, they provide this light therapy. I'll come on it later. What are the clinical segments where we use? So what are the various tools for using this? We use the lights for this, the lasers for this, the nature flowers, colored foods, home office interiors, chromatized water. Like you see the drink and all, you take sometime the Sprite, right? Sprite, everybody likes the green color bottle. Why they use the green color? Because it's more attractive, It gives you the soothing effect. If you use the white only, you will feel, oh, simple only, like a water only. So you will not be attracted to us. Like the medicines are all pharmaceutical. We use different colors nowadays. In fact, like for example, osteocalcium, you see, earlier they used to use the orange color. Now slowly taste preferences are also changing. So nowadays we are giving a chocolate color. So it's in form of chocolate candies and all we are giving. So we give this chromotherapy through the colored foods, through the interiors, through the chromatized water, essential oil, colored ointments, bath salt, lighting, candle, painting, clothing, accessories, jewelry, crystals. Likewise, many tools are there. So what is the principle behind this chromotherapy? Normally, our human physiology depends a lot on the light, isn't it? Like our diurnal circadian rhythm and the sleep-wake cycle are the biggest example for this, isn't it? So our biological clock resides in the anterior hypothalamus and your suprachiasmatic nucleus. These are the small group of nerve cell in the hypothalamus that control the circadian rhythm. Usually what happens, the light sensation reaches the brain from eyes and stimulates your SCN, that's a suprachiasmatic nucleus, for neurohormonal balance and the physical health and well-being as well. So this what happens is this chromotherapy actually, it assumes that diseases are imbalance of various energy forces in the body. And these includes color, sound, heat, movement, touch, and pressure. Usually the deficiency or excess of colors also result in disease. The biggest example is jaundice. You see your color, you have conjunctivitis, see your eye color, everything will change, right? Isn't it? So what we do, moment we see our symptoms are going off, our yellow color is turning to a normal, our skin color, our eyes turning from red to the normal eye color. So then we feel, okay, now we are not in disease state. So these are the biggest example. So ultimately, with this, we can say like color imbalance affects the person psychologically and physically and produce various symptoms. So to get rid of this, what we can do? We can use the appropriate color that body lacking is needed. So providing deficient color can restore the normalcy. So studies have shown that plant also grow and yield better with color therapy or your chromotherapy. For the plants also, their growth is better when we use the light, isn't it? So color or light profoundly affect our mind, body, and soul, which ultimately influences our mental, emotional, biochemical, physiological, and physical states. Like, for example, I'll tell, you're not in a good mood. So by that time, your appetite will be lost. Correct, isn't it? Like you are in a fresh mood, then you can go for eating anything. So for freshening, you use a different color. Correct. Like you are somebody got a injured, got a accident and all, and you are entering a hospital where no colors, nothing, dull colors, all that. You will become aggressive, you will be depressed, all that anxiety will be more, you will be in tension, stress will come. So for that now hospitals everywhere, the interior they change. So they want to give you the cool and calm effect in your body. So um, their strongest impact of these colors is on our psyche. That plays a major role in many diseases. So by addressing your emotional and mental imbalances, colors can reduce the harmful effect on our body. Normally, the ancient healers used to believe that red stimulate the mind and blood flow. Blue and white cools our body, and yellow alleviates the pain and inflammation. Correct. You see, you must have heard about wheel, flare, flame in our anatomy and physiology. We teach sometime. Whenever there is the injury is there, the three things will come: wheel, flare, flame. So there is a hot. The temperature is hot. That means red color. Correct. So likewise, then one scientist was there, Edwin. He was the pioneer for color therapy, who suggested that red stimulate the blood and nerves, orange, yellow excite the neural activity, and blue has a calming and cooling effect. It's all done on the clinical studies. Then one study was done by the Takata where he established a link between the sunlight and the blood. In 50s time, one American scientist was there, Jonathan, who demonstrated that light and colors influence the flocculation index also. And many in vitro studies are there which show that color impacts our enzymatic activity also. Like purple at 464 nanometer influences your glucose oxidase enzyme, whereas dark violet at 400 nanometers stimulates your cholesterol oxidase, cholesterol esterase, and different enzymes that are benefiting in your diabetes. Later in 1958, your one Dr. Robert was there. He found that the warm color like red, orange, and yellow, They increase the heart rate, blood pressure, respiration, muscle contraction, your ANS arousal, and whereas the cool colors have got a opposite effect. So, likewise, different studies were done. So, researchers also studied like colors impact on the psychological, impact what they have. Like red boosts the energy and stamina. Orange enhances the creativity and optimism. Yellow supports your intellect and joy. Green fosters the balance and communication. Likewise, the different colors have got different psychological impact. Like one study was there, I'll tell you, where it was like blue lightning when they do in Japan and Scotland, they reported the reduced crime rate was there. And whereas the pink painted prison wall were found to lower the intimate aggression. So likewise, so these colors exert a significant effect at the cellular and molecular level, influencing your mitochondria, RNA, and DNA as well. So in fact, the research shows that pineal gland is there that produces melatonin. That's a chronobiotic hormone we call. It increases usually in nighttime, and it binds to your MT1, MT2 receptors are there, thereby depress the central nervous system. Whereas it also interacts with your, the cell signaling molecules like epidermal growth factors and regulates the cell proliferation and differentiation. Studies are done. So apart from it, melatonin affects your MAPKK and ERK pathway, which control the gene expression and enhances the antioxidant enzyme activity, thereby neutralize the harmful free radical. It has, apart from this, it has got some immunomodulatory and anti-apoptotic effect also. You see, you will find out there are many papers on melatonin are given. That is, they say is like it alters in condition like depression, bipolar disorder, your sleep disorder, likewise. So in contrast, there's a hormone serotonin is there. That's we call a neuroexcitatory daytime hormone. It is low in these disorder, but high in hallucinogenic and psychotic states. So, light exposure also impacts your cortisol secretion with both blue and light increasing its production. A study was there that used your near infrared spectrometry. It indicated that chromotherapy can enhance oxygenation to the brain and muscles as well. There was one more study. It was done on the children with the atopic dermatitis that proved that chromotherapy combined with hydrotherapy and low intensity laser blood radiation improves the skin moisture, pH balance, and transepidermal water loss. So this is a generalized way I had told. And now some clinical applications, how we use the light and colors. So as I told, the colors have been used from a long time in disease diagnosis and treatment. So Niels Ryberg Finson was the pioneer who used the artificial radiation therapy for the lupus vulgaris, tuberculosis, and smallpox. And for this, he received a Nobel Prize in 1903. During your American Civil War also, your General Augustus was there. He promoted blue glass therapy, believing that blue light will aid in injury recovery, pain relief, and burn. And it was a successful experiment. Later, Advent was also there that used red color for neuroparalysis, fatigue, and chronic rheumatism, and yellow for digestion and bronchial tissue, and blue for the headache, sciatica, likewise. So one more actually researcher was there. He documented around 123 diseases effectively those were being treated with this chromotherapy. Coming to some adult studies, modern researchers have expanded, the scope of this chromotherapy as a complementary treatment for different conditions like anorexia, bulimia nervosa, insomnia, jet lag, seasonal affective disorder, chronic alcoholism, drug addiction, anxiety phobias, panic attacks, likewise so many. So red light, it was been proven to undergo wound healing and relieving the constipation. So, evidence also suggested that chromotherapy is potential in treating dengue fever, severe infection, cutaneous leishmaniasis, and hepatitis B. Then later, one Azami, the team research was there. They reported a case of cutaneous leishmaniasis that was successfully treated with your color therapy with no recurrence case after 6 months even of follow-up. So this chromotherapy can enhance even the athletic performance with the red providing a brief means. This is highly effective rooms, including with the special one research was there with head and neck cancer patient, even the cancer patients. So there was one more study.
Sir, your screen is not sharing.
Oh, wait, just a moment. Am I audible to you? Because I could see here
Yes, sir,
immediately.
it's audible.
I mean, whatever we have discussed so far, was it audible to you? Because just now I saw my this thing audible was been it was stopped. So I think I'm with you, right?
Sir, you're audible.
Okay. I'll
Okay,
make it full screen. Yeah.
sure.
So I was telling about one another study was there that assessed this chromotherapy impact on generalized anxiety disorder using various psychological scales, and it showed like reduction in anxiety and improved mood when combined with conventional treatment. So it has given a synergistic effect. Additionally, one more Indonesia one study was done where it has proven like purple chromotherapy significantly reduces hallucination when compared to a control group, highlighted its potential in mental health treatment. So likewise, it has got a, you might have seen whenever you go to a dentistry, they also use some lasers, right? The color. So it has got a significant use in dentistry also. That shows a reduced anxiety in patient undergoing the endodontic treatment. And auricular chromotherapy is there. It has shown promising result in managing the psychological trauma, panic attacks, phobias. And one study has reported around 93% positive response was there. So likewise, many studies are done in the Turkey. One physician was there. He combined this auricular chromotherapy with your eye movement desensitization and reprocessing. We call it at EMDR. With this, it could alleviate the chronic pain following your PTS, that is post-traumatic stress disorder. Later in Iran also, some researchers they discovered like chromotherapy can enhance the job satisfaction even and reduce the secondary post-traumatic stress in case of intensive care nurses. Additionally, it has shown the benefits in multiple sclerosis patient and hypertensive individual that reduces both blood pressure and your stress scores. So, sorry, this is so it has also supports in your deodorant when used along with the laser therapy. It can effectively treat the internal organ disease. Another study was also there, where anti-inflammatory medications, when given together with the chromotherapy, were found to be more effective in managing the osteoarthritis case than compared to the alone when given. In elderly patient, it has been used to relieve pain from distal diabetic angiopathy. So one study was there in 2021. Recently, it was done. It indicated that chromotherapy contributes to improved health balance in active women. Then this chromotherapy, when combined with other alternative therapies, also enhance its active effectiveness. Like example, when they combine this chromotherapy with aromatherapy, so it could manage the pulmonary and nervous system diseases. In fact, they have used nowadays. I think you must be knowing about saunas and all. They use the different radiations like infrared saunas. They are using for offering the mental benefits and aiding the symptom relief. Then experts suggest that if you incorporate this olfactory and auditory stimulation in chromotherapy-based saunas, it gives a greater impact. Similarly, in magnetotherapy, when combined with chromotherapy, it provides much enhanced benefits. Like silvotherapy, we call forest bathing, along with the chromotherapy or music therapy or the bibliotherapy. That's going through the literature. That's called as a bibliotherapy. Promotes overall health and reduces the risk of modern lifestyle related disease. Nowadays, I think you must have heard about in many of the IT companies in the Western countries, they bring the pets also. Pets when you are working on a system. So the different color pets, they will be bringing the cats, the white color, the orange color, like different. They will be bringing. They will come and they will touch. So it also reduces your stress, isn't it? For example, right now you are listening to my lecture, isn't it? So maybe some stress must be coming. Ayo, so much of slides and all. How much? But suddenly here, three, four cats come, small puppy comes with the different colors and all. So color affects ultimately. Here the light, the dim, all that, you will have a sleep also. If we dim on the light, all the lights are dim means you may sleep. So it affects ultimately our consciousness. So here in this color therapists utilize various tools to apply this chromotherapy. One is Grakvo's virtual scanning system, we say, that is we normally use for diagnosing, preventing, and treating chronic disease. So another few studies are there on pediatrics also. Like it has been proven like phototherapy using sunlight, blue light, or full spectrum white light is a established treatment for the neonatal jaundice. Normally for the children, the newborn baby, I think you must have gone to the hospitals and you would have seen they keep in some the we call nursing care, the ICU bed is there for the small newborn baby. In that they put the different lights exposure they are doing. So that is normally when it's a neonatal jaundice, we expose to different light like sunlight, blue light, or likewise. And emotional assessment, like single color emotion theory is there, or aura soma therapy is there. That is also assisted in evaluating the psychological effects. So in Japan, there is a Fuji logic system is there, and color your life therapy is there that assist in assessing the or treating the children's psychological issues. A small study was there actually. It was done on the 5 students. With that, they could find out that colors can help elementary school children to reduce their anxiety. Even during the COVID-19 pandemic, this chromotherapy supported many students in coping with the lifestyle changes, preventing the psychological distress. A control trial was done on some Asian student that also showed that exposure to the blue light combined with hydrochromotherapy effectively reduces the anxiety. So, as chromotherapy also improves the psycho-emotional state of primary school children with shuttering and reduce academic stress in nursing. A study was done on children aged from 6 to 10. They showed its positive impact, particularly with ADHD, for which normally we don't have much of the treatment today. For that also, it is been applied and got a good results. So interior color scheme have been shown to alleviate your autism and hyperactivity symptom. The baby is crying. What do you do when the baby cries? You take out the baby outside environment and you expose to different color. You bring to the park and all. Then they are very happy. They always says, "No, I want to go out." Why? Because of the different colors. Because of the light energy. So they are cool and calm there. Correct? So home automation system is there for autistic individuals, integrate chromotherapy and music therapy, and thereby activates to disappear the sign of anxiety and distress. So this chromotherapy also reduces your hospitalization related anxiety in the preschool children, leading to fewer crying episode and better treatment acceptance. That's why you would have seen nowadays in a hospitals and all, even in the play school for the children, normally they will use the greenery, more of the greenery in a hospital, in play school, everywhere, because it gives the psychological stability for the long-term pediatric inpatient. Like example, green light has been found to improve the lung function and reduce the asthma symptom in allergic children. Whereas, and the trials were done, whereas the blue light benefits atopic dermatitis by reducing the lesion size, itching, and improving sleep. Similarly, your hydrotherapy, non-selective chromotherapy, and low-intensity laser blood irradiation have shown the significant benefit for atopic dermatitis. Even in traditional Chinese system also, 5-color therapy is there to for the treatment of chronic urticaria in children. So, maybe you must be thinking it's a why I took this topic today, because it is out of the box. I'll come on it later. What is the scope? How it can benefit you? Definitely, it is very beneficial. I'll tell you. Some advances what we have done with this color therapy or light therapy or chromotherapy, we say that is to treat the deep internal organs. Researchers developed some subcutaneous light emitting probes and intravascular laser therapy. Likewise, here you can see on the screen some images there. So for this, they have developed like subcutaneous light emitting probes. So these are the device that emits light beneath our skin for biomedical application. Like these are based on miniature of LEDs, OLEDs, or your bioluminescent or chemiluminescent system. These are integrated with biocompatible encapsulation material like hydrogels, PDMS, flexible polymers for the safety of your in vivo subjects. And it has got a various application now. New word is going now in a pharma. Normally we work on optogenetic nowadays. That's part of this. Like the advancement is intravascular laser therapy also. You can see some images on our right hand side. So this IVLT is a minimally invasive medical technique, we say, when a low level laser is introduced directly into the bloodstream via a vein that typically use a fiber optic catheter, which is considered as a part of photobiomodulation therapy and is used to stimulate the biological processes at cellular level. And if you see that clinically, where we apply commonly in the doctors are applying today in serious disorder like atherosclerosis, ischemic heart disease, hypertension, metabolic disease like diabetes, dyslipidemia, neurological condition, migraine, chronic fatigue, neuropathies, infection, inflammatory disease. So likewise, many conditions are there where we are applying this advanced form. Another is photobiomodulation, we say PBMT. It is also called as low level light therapy. So it is a form of therapy, that utilizes the non-ionizing form of light sources, including laser, LEDs, broadband light in the visible and the near infrared spectrum to stimulate the cells. So it is basically a non-thermal process, I'll tell you, which involves endogenous chromophore that elicit your, photophysical and photochemical events. So these devices are usually FDA approved, and FDA has already approved this one. And the light here, it is absorbed by the photoreceptor in mitochondria and cell membrane. This usually activates your mitochondrial ATP production, and the increased ATP further activates your signaling pathways that promotes the cell proliferation, migration, and differentiation. So thereby, in this, a light source is placed. You can see here one image is there. Is placed near or in contact with your skin that allow the light energy to penetrate the tissue where it interact with the chromophore, and resulting in the photophysical and photochemical changes that leads to further alteration molecular, cellular, and tissue level of the body. So here the light induces a complex chain of reactions in disease and damaged tissue to accelerated wound healing and the tissue regeneration, increasing the circulation, and many other functions are there. So interestingly, this research, indicates that light can enhance the performance in normal tissue and cells also. Another technique is there, photodynamic therapy, we call PDT.
So this is also another advancement wherein CT is being combined with the specific light source to the target and eliminate the cancer. Normally for the cancer, you might have heard it's a very costlier, the treatment they say they use go for radiation therapy. This is not nothing but it's a photodynamic therapy. So here they use three components. One is photosensitizer, that is a light activated molecule or drug. Second is light source, that is usually the laser or LEDs or some other implantable light probes. Then oxygen, which normally interact with the excited your photosensitizer to generate the ROS. I think you must be knowing reactive oxygen species. So how we administer, this is given systemically, sometime IV or oral or topically also. So mechanism is, firstly what happens, it happens accumulation stage where your photosensitizer will be localized in the diseased tissue part. Secondly, your light irradiation will be done. That's a specific wavelength will be given that will excite your photosensitizer. Example, your porphyrins, it will absorb the light from 630 to 690 nanometer. Then second is, because of this, ROS will be generated that will transfer their energy to the oxygen and free radical will be generated. Thereby, the therapeutic effect will become is tumor cell killing will be there, damage of tumor vasculature will happen, and further immune system activation will occur. So another advancement is we are using gene therapy for color blindness also. That's the biggest one. Even for the color blindness, we use this. So researchers normally they are exploring, the gene therapy as a potential treatment for color blindness, where what they do is they take a faulty genes and which are responsible for color perception and replace it, which allow individual to see the wider spectrum. So how they do it, like example, in University of Washington, they developed a gene therapy that restore the gene that codes for missing and faulty light sensitive pigment. And thereby they allowed the cone cell to detect the color and that they could not detect it previously. So this therapy has been tested in animals also that have the cone cells sensitive to the wavelength of blue and green light, but insensitive to those for the red light. So for those animals also they have used. Another advancement is hydrochromotherapy. So it is a type of color therapy that uses visible light to treat water. So this process involves exposing the water to electromagnetic radiation in the visible range for ingestion. Likewise, we have safety and some limitations also because every technique has got some benefits and demerits, right? So usually if you see, chromotherapy is relatively safe and well tolerated, but there is a theoretical possibility like retinal damage may happen due to blue light and violet in one of the study they have seen. So a Japanese researcher also pointed out like that it has got its own limitation, like it might not work in all situation the way one desires sometime. Though it does affect the emotion, behavior and cognition and this effect may vary both in quality and quantity as well. Most of these deviation are, probably due to different meaning and association of color in different culture. So these individual choices and liking for a particular color also affects the results. Coming to your conclusion part, many studies have been done that highlights the potential of benefit of this chromotherapy in mental and physical health. So this chromotherapy stress-inducing effects cannot be denied, and this makes it as a low-cost, non-invasive, and safer supplementary treatment for any chronic condition. It is very simple to administer and require minimal equipment and chromotherapy. Before your widespread adoption, a large-scale multi-center studies, although should be done before applying it. Okay, so the proper research can validate and enhance its role in health promotion, disease prevention, treatment, elevating this therapy credibility in modern medicine. Now we think how it is beneficial for we as a pharmacist. We all are, many are here must be sitting who work on a pharmacology, who are working on a medicine chemistry, making a different formulations. If some are working on a, the biomedical science. So the people who are working on a stress, depression, aggression, anxiety, blood pressure, sleep disorder, color blindness, and different type of cancers and skin infection, so they all can work into the segment. You give, what you can do is you take a medicine, um, note down its effect, then you use the your chromotherapy individually, note down its effect, then you give both together and you can study. It's a different world, I am telling you here, because we all apply for the research grant, we apply normally in medical or pharmacy or likewise. But here in India, we have, I think Ayush is there. We have NIH, NCIH is there. You can apply for the grants over there. And for this, you need not be an expertise in this. Just what you need to do is you need to collaborate with a chromotherapist who is already a registered practitioner, who is a chromotherapist. With them, you collaborate. You keep a pharmacologist with you keep a biomedical scientist with you keep a biotechnologist with you, and you keep a, if you are, it's your chemistry work, you can go with that, also medicine chemist, and you keep a chromotherapist with you, and you apply for a grant. Easily you will get a grant, I'll tell you. So with this, I'll tell you, I mean, because so far it's on our fingers. I don't think people, they are working on a onco, the optogenetics and all. A new field has been arriving now. Like in the animal models also, we use the light and shade, but we are not using all the different colors. So you go with a quantitative aspect completely. Here we go the qualitative only what we are going. So this is my, that's all. So these are some references, whatever the scientist name I told, these are the reference for the same. So with this, thank you so much for your patient hearing. I hope from my side, I have delivered something new, which normally we as a pharmacist, we don't practice in our research. So this is a new area you can see here. In combine your this chromotherapy with your normal pharmacological experiments, taking a chromotherapist in your study, then I'll tell you, it doesn't matter whether you are a B Farm first year, second year, third year student, doesn't matter. You need to take your lecture as a co-supervisor. You will be the the research student, and you take another team of collaborator and design some new project. So that's all from my side. Thank you very much for your patience. Thank you. With this, I stop my talk here. Thank you.
Thank you very much, sir, for sharing your valuable insights with us today. Your words have been truly inspiring and enriching for our academic community. We deeply appreciate your time and effort, and we look forward to welcoming you again in future for such more enlightening sessions. I would also like to express our heartfelt gratitude to our Honorable Chancellor, Dr. Asim Chauhan, our Honorable Vice Chancellor, Professor Dr. D. Subhakar, our Vice President, Dr. P.S. Ali, our Pro Vice Chancellor, Professor Dr. Monit Kapoor, and our Director, Professor Dr. S. Mohana Lakshmi. Thank you so much. I now request everyone to please stay back for photograph. Thank you.
So can I leave the session now?
Yes, sir. Thank you so much
Okay.
again.
Thank you. Thank you so much. Thank you. Yeah.
Thank you, sir.
Thank you, madam.